Welcome back. I'm Miranda Kahn. Popping up in today's health radar, a possible new treatment in the fight against cancer. Venom from Brazilian wasp could be used to battle the disease. Lab studies showed the toxins in the wasp sting killed cancer cells but didn't harm healthy ones. Researchers at the University of Brazil hope to use this as a treatment, though human use is very long ways away. A new anti-HIV drug shows promise in the first real-world studies. More than 650 people, mostly homosexual men, began taking the drug during a 3-year period. During that time, none of the high-risk participants contracted HIV. CVS Health says its ban on selling tobacco products has put a dent in sales across the country. The health company says it's reduced the purchase of at least 95 million packs of cigarettes across all of its stores. CVS enacted the ban about a year ago. A new study finds more and more college students are choosing to smoke marijuana over cigarettes. For the first time, daily pot use now surpasses daily cigarette use. Researchers say the shift could be because more and more people view marijuana as less dangerous. The Affordable Care Act may soon see one of its biggest unintended consequences. The Cadillac tax, a tax placed on high-cost health benefits, will take effect in 2018. This tax will hit multiple health providers, and they'll be looking to save those costs in ways that could hurt you, the consumer. And here to explain more, we turn to Newsmax Deputy Health Editor Nick Tate. He is the author of the New York Times bestseller, ObamaCare Survival Guide, seen right there. Thanks so much for joining us here on Newsmax Now. Always good to have you.
My pleasure.
So first off, what is this Cadillac tax?
Well, the Cadillac tax was intended to discourage very high-cost health plans. It's a 40% excise tax on health care plans that companies offer that cost about $10,000 per individual and $25,000 per family. The idea is put a tax on them, drive down the cost of health insurance. The problem is that despite the design and intent of that provision, the likelihood is companies that provide flexible spending accounts, these are these accounts that allow you to set aside money pre-tax to buy eyeglasses and co-pays and pay for things that your insurance doesn't cover, count toward that number, toward this Cadillac tax. And what many experts are saying, policy analysts who are looking at it are saying, in fact, the easy way that companies will be able to avoid that big excise tax is just to simply eliminate these flexible spending accounts. And so what we really have here is another situation, another case where the so-called Affordable Care Act is likely to drive up the cost for individual consumers.
So it's turning out not to be so affordable after all. Healthcare actuary Rich Stover said this to Politico. They'll be one of the first things to go if the Cadillac tax doesn't change. FSAs will go away very quickly. And a lot of people are coming out against this. Some politicians are already talking about it, like Bernie Sanders. Surprisingly,
I mean, this is one of those cases where we might actually have Bernie Sanders on the one hand and Donald Trump on the other agreeing that this is bad for the country.
What's going on?
Which is, you know, almost unheard of. But Bernie Sanders has said that if he's elected president, this will be one of the first things that he junks when he gets into the White House. Even Hillary Clinton has suggested that she would take a look at this tax. She doesn't like it either. There are laws that are legislation introduced in both the House and the Senate by Republicans and Democrats that would scrap this provision of Obamacare. And I think this is another case where we're going to see, if we don't see full-scale repeal of the law, we'll see certain targeted things go away. This seems to be one that's going to be on the chopping block.
Okay, in the short time that we have remaining, I want to talk about another topic that's been in the health news lately, Legionnaires. There's been outbreaks popping up all over. This has been in the news the past few months. There was one at a California prison. First off, for people who are not familiar with it, what exactly is Legionnaires?
Legionnaires' disease is a form of pneumonia. It's typically spread through HVAC systems, water cooling towers in big buildings that are not properly handled, and in buildings that have been shut up very tight for energy efficiency reasons. For people who are sick, have a pre-existing condition, seniors, they're much more susceptible. So far, we're now seeing 19 deaths, 11 injuries in New York, California, Pennsylvania, even Phoenix. They're starting to see it. This is an extraordinary number of cases.
Yeah, it's exploded this year, but this is really nothing new. Why do you think that is?
Well, you know, we don't know. It could be that as folks are trying building managers are trying to cut down on savings, they're closing the buildings in tighter, maybe cutting down some on management costs by not maintaining the facilities as well. But the bottom line is, more money will be spent on healthcare than could be spent on simple maintenance. The good news is, indoor air pollutants like this, you have a greater degree of control than outdoor air pollutants. It's just that we don't tend to think of them. We think of pollution, we think of factory
we think of outdoor air.
We think of exhaust, and that's where we spend hundreds of billions of dollars to regulate. Not as much money is spent on indoor air pollution, but that's an area that needs more attention. The good news is you tend to have more control over your indoor environment, your home, and your workplace.
Right.
If you're feeling sick, if people in your office are getting sick, talk to your boss, talk to your building manager, see what you can do.
Good advice. Nick Tate, author of the New York Times bestseller, Obamacare Survival Guide. Always good to have you here on Newsmax Now.
My pleasure.
And coming up next, the Army has a new policy when it comes to soldiers who want to enroll in its elite Ranger School. We'll tell you all about it. And a fast food worker refuses to serve a police officer. Find out why when we break that story down with Rick Unger and Chelsea Henry. That's all coming up next in today's Roundtable.